In this video lesson, we'll be covering a nurse care plan for the nursing diagnosis of risk for activity intolerance. This review is designed for nursing students and professionals looking to enhance their understanding of this critical concept. We'll cover its definition, risk factors, assessment focus, expected outcomes, ongoing assessments, nursing actions, and therapeutic interventions. By the end of this session, you'll have a clear framework for managing acute pain in pulmonary patients. Now let's begin. Activity intolerance refers to a state where an individual is at risk of experiencing insufficient physiological or psychological energy to endure or complete required or desired daily activities. This diagnosis emphasizes the potential risk rather than an actual limitation, which means proactive care is essential. Risk factors. Some key risk factors contributing to risk for activity intolerance include generalized weakness such as after surgery or illness, sedentary lifestyle or prolonged bed rest, conditions affecting oxygenation like anemia, chronic obstructive pulmonary disease or heart failure, decreased physical stamina due to aging, neuromuscular impairments that limit mobility or strength. Assessment focus. Assessing for activity intolerance involves evaluating a patient's physical, psychological, and social capacity for activity. Key focus areas include vital signs, monitor heart rate, respiratory rate, blood pressure, and oxygen saturation before, during, and after activity. Physical strength. Note any difficulty in moving, walking, or completing tasks. Fatigue levels. Use patient-reported scales to quantify fatigue. Emotional response to activity. Look for anxiety, depression, or frustration tied to activity performance. Medical history and medications. Identify conditions or treatments that may impact energy levels. Expected outcomes. The nurse's goal is to help patients achieve measurable and realistic outcomes, such as the patient will verbalize an understanding of activity limitations and safe activity levels by the end of the care session. The patient will demonstrate improved tolerance to activity, as evidenced by maintaining stable vital signs during light activities. The patient will report decreased fatigue and an improved ability to perform activities of daily living within 1 week. Ongoing assessments. Continuous assessment is vital to track progress and modify care plans as needed. Focus on the following: monitoring vital signs during and after activity for abnormal changes, assessing energy levels frequently and asking the patient to rate their fatigue, observing physical responses to activity such as labored breathing or muscle weakness. Nursing actions. Now let's explore 3 nursing interventions that promote safety and energy conservation, along with their rationales. First, teach the patient to use energy-saving techniques, like sitting during grooming or spacing activities throughout the day. These strategies reduce energy expenditure, helping to prevent fatigue and promoting recovery. Second, encourage the use of assistive devices, such as walkers or canes, for mobility. Assistive devices provide physical support and stability, reducing the energy required for movement. Third, schedule activities during peak energy times. Aligning activities with periods when the patient feels most energetic ensures optimal performance without overexertion. Therapeutic interventions. Here are 3 therapeutic interventions that support improvement in physical stamina and activity tolerance. First, design a progressive exercise program, starting with passive range of motion exercises and advancing to light aerobic activities. Gradual activity builds tolerance and strengthens the cardiovascular and musculoskeletal systems safely. Second, provide positive reinforcement and set small, achievable goals. Encouragement fosters confidence and motivation, leading to sustained engagement in activity. Third, administer oxygen therapy as prescribed during activity, if necessary. Supplemental oxygen enhances tissue perfusion and reduces dyspnea, enabling safer participation in activities. Well, that ends this video. If you found this review helpful, don't forget to like, share, and subscribe for more nursing care plans and study tools.